Today we'll discuss 6 reasons for reduced ejaculate volume or semen reduction. This is a common complaint in medical offices. Many men are worried about noticing a decrease in their ejaculate volume. This can be linked to various causes. We'll cover 6 of these causes today, but first let's understand what's considered normal ejaculate volume. On average, a man ejaculates 2 to 5 milliliters of seminal fluid each time. This can vary based on age and the patient's overall health. 3 mechanisms cause volume reduction, linked to the causes we'll discuss. The first mechanism is a drop in production. Semen production involves the prostate, seminal vesicles, bulbourethral glands, and testicles. It's normal for production to decrease with age and the aging process. So the first mechanism is a decrease in fluid production. The second mechanism is retrograde ejaculation, which is defined as ejaculation that goes back into the bladder instead of following its normal path forward, its usual route to be expelled through the penis. Later, we'll understand the causes associated with this retrograde ejaculation. There are several, but it's important to always inform the patient that it doesn't cause any harm or damage. What happens is the semen goes back into the bladder and later comes out in the urine. This only affects patients trying to conceive naturally, as it may cause fertility issues. The third mechanism is obstruction of the ejaculatory duct. Semen is produced, but an obstruction prevents it from being released. Now let's look at the causes. The first cause is age-related, as we mentioned earlier, with the decline in seminal fluid production being common as we age. The second cause is increased sexual activity or excessive masturbation. This one's pretty easy to understand. The more a patient stimulates himself or masturbates, the less semen volume he'll naturally produce. If he abstains from masturbation or sex for longer, his ejaculate volume will increase. The third cause is medication-related. Here we have various drugs that can affect ejaculation dynamics. First are medications for benign prostatic hyperplasia. The alpha blockers, tamsulosin and doxazosin, can cause retrograde ejaculation. This is a very common side effect reported by patients using these medications. The second type are drugs that shrink the prostate, also used in treating hyperplasia. Finasteride and dutasteride reduce seminal fluid production. Antiandrogens block testosterone, lowering sperm volume. Some chemo drugs and antidepressants can also affect it. The fourth cause is surgeries, for instance, prostatectomies for prostate cancer treatment. Radical prostatectomy removes the prostate and seminal vesicles. This patient won't ejaculate but can still have orgasms. He can have erections and orgasms, but no ejaculate. Prostate TURP can also affect ejaculation. This often leads to retrograde ejaculation into the bladder. Other surgeries worth mentioning are retro and retroperitoneal surgeries, which can cause nerve damage and anejaculation. A common question about vasectomy is whether it reduces ejaculation volume. Folks, vasectomy is simply disconnecting the vas deferens from the testicle. In reality, the testicle mainly produces sperm. It contributes very little to overall semen volume, so vasectomy doesn't actually change ejaculation volume at all. The fifth cause, which is quite common in our field, is diabetes. Diabetes can cause diabetic neuropathy, which inhibits the ejaculation reflex in some patients due to nerve damage. The sixth and final cause is spinal cord trauma. Some spinal cord injuries, depending on their level, can impair the ejaculation reflex, leaving the patient unable to ejaculate. If you found this content helpful, share it with others who might be interested. Like the video so YouTube knows it's valuable and shares it with more viewers. Don't forget to subscribe and turn on notifications to catch new videos. Thanks for watching. See you next time.